Uh, Sanjay, you can start.
Yes, sir. Good evening, friends. First of all, I would like to once again verify whether am I audible or not. Hello.
Yes,
Okay.
to me you are audible.
Yes,
Dr.
yes.
Prakash.
Dr. Prakash is not there. Dr. Fatima is there. Okay.
Hello.
Yeah. Dr. Fatima.
Yes, sir.
Is it audible?
Yeah,
Yes.
yeah.
And screen
Yes.
visible?
Yeah, of course.
Okay.
No problem.
Okay. Thank you. Thank you, madam. Right. So, good evening, friends. Once again, back to our series of a webinar of competency-based medical education. Today, we will discuss about the logbook. Recently, I think MEU members and curricular committee members attended a workshop conducted by a regional center with regards to CISP. It was 2 days program. Some important aspect we are going to discuss today with regards to microbiology, right? The most important part which we are supposed to prepare is a logbook. Right? So our discussion would be on logbook. A very important thing in graduate medical education regulations 2019, two important things which are important for perspective of microbiology. One is skills training and second is ADCOM. We all know that this competency based medical education is now stressing upon skills. And once we get deeper into that, we'll be able to identify what exactly that means. The skills which has been laid down that starts with first MBBS and will have incremental level that will go on training in second MBBS, third MBBS, fourth MBBS, and internship. So there are certain portions of skills which we are supposed to teach them, right? It is not only teaching, but it is also important that we certify them that the students have learned the skill. So one important point is skill training. Second is ADCOM. ADCOM module, most of you have gone through that. There are modules for first MBBS, second MBBS, third part 1 and part 2. So there are modules which we are supposed to teach in second MBBS. The responsibility of teaching of this module lies on the teachers of second MBBS and especially those teachers who are part of medical education unit. Now this module is a common module and it is vertical module which starts with foundation course, then in first MBBS, then in second, part 1, part 2. There are teaching hours dedicated and modules are dedicated. So second MBBS group of teachers need to sit together and divide this ADCOM modules that who are going to teach them. It is very important that the entries of such type of teaching and learning has to be rolled into the logbook and portfolio. So remember that our ADCOM teaching is also very important and it has to be registered in our logbook. ADCOM has to be assessed. Some questions are to be there in our internal examination of each subject of second MBBS, that is in pathology, microbiology, and pharmacology, right? So remember, ADCOM is also very important. That module is available. It must be read by all the faculty members. Soft copy is also there on MCI website. And even in Google Classroom, we are going to put it. So over here, our important thing is skills training, second MBBS. Remember that when we talk about skills, the skills are to be listed and they need to be identified from the competency which is being narrated by Medical Council of India in volume number 1, in which there is a microbiology competency. Over here, if you look at that, the skills are all this which is listed here, MI 1.2, 3, like that. These are total number of skills. How to identify these skills? You can look at the teaching learning method in which you will identify there is DOP, there is performance. So all performance which is being given in that competency book, they becomes skills training. Second thing, teaching learning method, you look into that. If it is DOP, it is skill. And third thing, if you look into the domain and the level, if the domain is skill, it becomes skills. And if the level is shows how, then it becomes skills. So you'll have to identify, you'll have to differentiate all the skills. And these are the total number of microbiology skills which we are supposed to teach them. It is not only teaching, but we need to ensure that students learn this skill. And once they learn the skill, they'll have to demonstrate that they can perform this task. And once they can perform this task, we need to certify them, right? So these are simply lists. Once again, we will discuss that. Now, how we are supposed to go for skill teaching. Over here, very important, what we can say, a classification of a skill based on the relevance or criticality, and second, feasibility, right? So vertically you can see it is a feasibility, and horizontally you can see the relevance. The vertical, you can see the bottom is low feasibility, and top is high feasibility. Horizontal bar, you can see on the left side it is low relevance, and the right side it is high relevance. It has been taught to, or this session has been taken by Dr. Ritu when she was talking about teaching learning methods. Over here, you can see the first of all, low feasibility and low relevance. These are the skills which experts will identify. The microbiologists among the state or microbiology within the university or few experts can sit together and identify out of skill that with skills feasibility is low and relevance is low. As for example, this is not regards to microbiology, but this is regards to general skill applicable to all students. I'm just giving one example. The nasal endoscopy, right? The relevance is low and feasibility is also very low. Over here, although it may be written in a competency book as a domain skill and shows how, but remember that you can classify over here into low feasibility and low relevance, and where simply the students need to be aware about that. This can be taught in small group teaching learning. Simply tell them, show them the pictures, show them the procedures in video. That is sufficient, right? Because the feasibility is low and relevance is low for Indian medical graduate, that is MBBS student. The second thing is relevance is low, but feasibility is high, right? As for example, Mentox test. The students may not be asked to perform Mentox test, right? Medical student or medical graduate, but feasibility is very high because very frequently such type of procedures are being conducted in the pathology laboratory. So over here, you can take the student to the laboratory where they can observe the Mentox test process. What is important? Process is not important, but over here, the interpretation is also very important than the procedure itself, right? So these two things over here, you can see one is simply a teaching by some media, one by observation, showing them the real life situation, but they are not performing anything. Third thing is feasibility is very high and relevances is very high. You can see ECG, right? This is simple a technique, and over here you are not putting either a volunteer or a patient into danger, right? Patient coming for some diagnosis, or there is some volunteer and simply putting the lead. If it is feasible, yes, definitely. If it is feasible, the students can perform. If they can perform procedure, that is good, but at least they should interpret the normal ECG. So remember, based on the input or chance of teaching learning, if it is feasible within the institutions and the relevance is high, the chance is to be given to the student, right? We can, over here you can put that feasibility is very high and relevance is very high if we talk about gram staining, right? Definitely you can take the sample from a patient and you can give it to the students. Student would perform gram staining and they can identify the organisms. Remember, over here, what is important? The teaching learning pathway should be made in such a way that they will pass through such type of performance. So all of us should have a practical session of gram stain, a practical session of Zn stain, a practical session of stool examination. It is very important. Student would learn that and it would be certified based on individual performance. So that is the third thing which is most important. And this all things should be done with DOPE method: demonstration, observation, assistance, and performance, right? The last thing is the relevance is very high, the feasibility is very low. As for example, cardiopulmonary resuscitation, right? Basic life support. Now it is very difficult to even demonstrate or train the students on a critically ill patient. Over here, the institute will have to build the capacity because student is to be certified that he knows the basic life support, or for the resident, it is advanced life support. So there should be a skill laboratory in which the students would be taught about the basic life support, and student need to be posted or other session has to be conducted on basic life support. So this is in short how the skills are to be classified and what particular teaching learning mode which you are going to adopt, that we have to decide, especially with regards to microbiology. Okay, over here, I'm just taking one example of one of the skill which is to be taught in microbiology. This is the gram stain. The skill is a gram stain. So first of all, before the batch comes, we'll have to start working on that. And this particular skill is being taken from one of the competency, right? It has been prepared. So skill is gram stain. And for the gram stain, we'll have to derive the objectives, what they are supposed to do in gram stain. Over here, I have just simply taken one objective because this is skill training. And in that, you can see the student at the end of the practical session should be able to perform gram stain correctly on a given smear. That smear may be obtained from the patient of a respiratory infection or any other infection. The teaching learning method would be DOPE, or even smear can be prepared from already cultured organism, no problem. The teaching learning method over here would be DOPE: demonstration, observation, assistance, and performance. So if you think about that, this particular session is now further divided into different points. The first session would be introduction, in which a large group introduction about gram stain would be explained to the student. The next step would be the demonstration. One tutor in small group would demonstrate gram stain process. Second thing would happen, the student would observe when the tutor is going to perform that. Then student would be given the slide that you all know they will be performing, and tutors would be helping that, and they would be correcting their mistakes. Once that is over, the last thing would be independent performance, where student would be performing without any type of assistance and would come up with the stain slide, right? So this particular gram stain demonstration, as for example, or the process can be break up. The step 1, as for example, preparation of a smear. Step 2, fixation of a smear. Step 3, that is application of a primary stain. Step 4, application of a modern. Step 5, washing step. Step 6. So I'm not enumerating all the steps, but you all know what are the steps of gram staining, that you need to break it up. The student would able to understand that and would be able to demonstrate their understanding, right? Then this session plan would include infrastructure. What would you require? You will require a slides, you'll require a reagents, you'll require a microscope. So once that is over, the assessment has to be planned, that how will you assess that students demonstrate that they can perform gram staining, and it can be done with the help of objective structured practical examination. This can be a separate session, this can be a formative assessment, this can be a part of internal assessment, right? Anything. But over here, the assessment is for the teaching the student that they have understand and they can demonstrate their understanding by performing gram staining. So this would be required for each and every skill, and session plan has to be prepared for that. Okay, so now we move on to the logbook. What is a logbook? As explained or defined by Medical Council of India, logbook is a verified record of the progression of the learner, documenting the acquisition of requisite knowledge, skills, attitude, and or competencies, right? And logbook maintenance becomes compulsory for each and every medical student. When they approach or when they appear summative examination, they must bring along with them the logbook. The logbook is submitted, and that makes them eligible to appear for university examination. Another thing which is along with the logbook, logbook is simply a log of all skills which they have already acquired. The logbook is not the detail how it is acquired and how that was assessed. For that, you need to put either a portfolio or annexure. So what is portfolio? Portfolio is an evidence of event documented in logbook. It is desirable one. And if you're not putting portfolio, you'll have to put an annexure. It is a part of a logbook with documented details. Now over here, this is something very important. And we'll discuss this logbook issue. What you need to put in logbook, first of all. So logbook is collection of all microbiology competency that is important, that will lead to acquisition of skills. So anything in competency table which is described as performance, shows how, or outcome, must be put into logbook. So once again, all skills in which there is a performance. The domain is skill and the level is shows how. And anything which is attitude and communication, you'll have to put it. Otherwise, cognitive skill, knowledge level, cognitive skill at the level of knows how is to be avoided and it should not be put into a logbook. So the logbook would have for microbiology all skills and also portion of ATCOM. ATCOM over here, don't confuse the ATCOM module. I'm talking about ATCOM which is being part of microbiology. You must have studied few of the competency over here. If we discuss this, the first is perform and identify different causative agent of infectious disease. Over here you can see in the first one, 1.2 gram stain is important, ZN stain is important, and stool routine microscopy is important. MI 2.3 microbial agent, rheumatic heart disease, infective endocarditis. Then malaria, then diarrhea and dysentery, then enteric fever, then meningitis, then URTI and LRTI. Then PPE becomes very important where it can be further divided into hand washing and use of PPE, that is donning and doffing. Then collection of sample. Then transport of sample is very important. Over here, the last is you can see attitude and communication, right? Some affective domain is also coming. Confidentiality pertaining to patient identity, right? And then choosing and interpreting the result of laboratory tests. So some of them are skills, some of them are affective domain, right? Psychomotor domain and affective domain. Knowledge domain is not being mentioned over here. So these all things we'll have to put it into our logbook. Now, how to have an entry into logbook, that is also very important. I'm just giving one example of that. The competency MI 1.2 gram stain. The teaching learning session is the first thing where student is supposed to attend. There is a date 111 when they attend for the first time. So we write F. Then we'll have to rate it. Rating is based on some questions because over here this is a teaching learning session and students should be able to describe the principle and procedure of gram stain. If he writes it perfectly in his practical manual, you check it and you certify that it meets your criteria. You need to decide what is the criteria for successful completion of competency. Over here is completing that. So we are writing M. He meets the criteria. So your decision as a teacher that he has completed the skill, right? And whether would you like to put it in your logbook or portfolio or journal as an evidence? Yes, you can put it because it will be there in your journal. Student must have written the procedure and principle of gram stain, right? So you sign it and the student would sign it, right? Second session would be of demonstration. You can do it on same day or another day. Once again, the attempt is first, is meeting the criteria, so that is complete. Whether you want it to attach into your logbook, this journal or practical manual or portfolio, no, you don't want that entry, right? You are certifying directly, you are signing, and then student is being explained and he has been feedback is given and signature is obtained. Now comes the performance part where student would be performing on the same day or another day. On the first attempt, and he is not successfully completing the skill, right? The training, rather, he is not able to perform the gram stain. So it is below, right? Is below the criteria. So what you do, your decision would be either you give a repeat or remedial. We'll come to that later on. Would you like to put it in the logbook, rather manual or portfolio? No, you sign it and student would sign it. You explain that this is not as per the standard, you need to repeat it. Then once again, student would perform that on the another day. And over here, you can see the attempt is repeat. Over here, once again, he is not able to complete that. Now, you can say that I'll give it for 2 times. The repeat is given for the 2 times, and then you have to decide. Now, remedial measure is to be done. A remedial measure is once again explaining the student what are the faults. You identify that and explain that particularly, right? That how it is to be corrected and how he can perform the skill successfully. So giving that feedback, you sign the journal, the student would sign it, and once again, student would perform the same skill on another day. The attempt would be remedial, and over here, now student is meeting the criteria. And over here, the student has completed the skill. Would you like to enter into the logbook? Yes, you can attend. You can add into, and you can put an entry, and you can put the date, and over that particular date, the student has completed the skill of gram staining, right? So you sign it, the student would sign it. And there is one more, that is another thing, that is interpretation, right? Not only showing the gram positive negative, but he should be able to identify, he should be able to interpret the clinical interpretation also, right? So once again, first attempt, he exceeds your criteria, the decision is yes, he has complete. And would you like to enter into your journal? Yes, you sign, the student would sign. Remember that these all are hypothetical thing which I am telling to you, right? It will vary according to the student. It will vary according to how you are going to teach your student, how many repeat you are going to give, and at what time you are going to look into remedial, and what is your expectation, right? So everything is, will have to, as an expert, will have to devise this thing. Remember, so this is only about the logbook and only about one particular skill. We'll have to identify this particular method for all other skills which is depicted by Medical Council of India, right? In particular competency book. So it is once again going to be a long exercise, and it will depend on the policy of institution and policy of particular department, that how many trials you are willing to give them, and what will be the criteria for successful completion. So remember, this is very important, as you are certifying that as per the competency table, the skills which are being depicted or rather narrated in the competency table, you have successfully transferred that skill to medical student, right? So further use of such skills will be incremental, and at the step of internship, when he'll come, he will perform the higher skills which is based on such type of skills, right? That is how Indian medical graduate will become a skillful, and that is how it is going to transform the medical education into competency based medical education. So another important thing now, what comes is this one, right? This is what we are planning for our institution. You can see the logbook would be the first part of our journal or practical manual. Now there are certain skills which are not being described in the competency table, but you need to put it, right? Because that is a minimum standard. There is no maximum standard. So you can put it, and this will become a complete one. And this is also not a complete if many of the experts who are present over here would like to put something more, they can add into this, right? So this is the first list which we have prepared of 23 practicals which we are going to do, right? That will start with the microbial world as for example, followed by infection control practices. See, for each one, we'll have to describe the session plan, and once again logbook entry, how we are going to differentiate one particular infection control will be having multiple sessions, right? You have a session of hand washing, you'll have a session of PPE, you can have a session of waste disposal, like that. You can go on putting that inside, right? So once again, too much of the things which we need to complete in a future time. Second is, you can see after that microscopy, right? Because it is also very important. We need to teach them how to focus into low power, high power, oil immersion lens. Then general introduction about laboratory diagnosis of viral, bacterial, fungal, and parasitic infection. Simple demonstration along with the introduction of theoretical aspect. So in the first term only, they know everything about different type of pathogens. Then collection and transport of a specimen, gram staining, ZN staining, stool examination, hospital waste management, immunology and serology. Then there are certain specific skills which is being described like rheumatic fever, bacterial endocarditis, malaria and filaria, HIV, diarrhea, enteric fever, meningitis, encephalitis, respiratory tract infection, that is URTI, LRTI, and also a separate session of tuberculosis, then genitourinary and sexually transmitted infection, and laboratory result confidentiality. So this is a primary list which is being prepared by our team at our institution. I'm just putting it over here. So this is how the thing will work out. So remember, it is not only about abstracting the objectives from competency, it is also very important to develop the skill module, right? Logbook and practical manual. So over here you can see the practical manual is totally changed, and we are talking about the systems and the infection and its laboratory diagnosis. Naturally, when you do that, the culture report and other biochemical reactions will have a little role in this. The primary role will be, the most importantly, will be of microscopy, especially gram stain, ZN stain, and later on in parasitic and other infection, the stool microscopy will have a very important role. Rest of the things, once again, as it has been explained, what can be done for a performance, what can be done for observation, what can be done for simple awareness would be sufficient. Remember, over here, we are cumulatively going towards making up of competency-based medical education, and we are not forwarding into developing a microbiologist, right? So we need to restrain from adding too much of our some of the important things which we are putting that we feel that it is important, although it is important, but not for Indian medical graduate knowing culture, characters, and different medias, right? Rather, they should know which are the samples which are important, how to collect that samples, and how to transport that samples, which are the tests which are available, how the report would come, and how to interpret the report, right? Many times I have seen the resident are not able to identify, or they are not able to interpret what is the meaning of sensitivity report, what is the meaning of S, and what is the meaning of R. R stands for resistance and S stands for sensitivity. So we all feel, right, that that is very important, that a resident MBBS student should know that, rather than mugging up the culture media and biochemical reactions, right? So that is simply the message which we are going to send. right? So with that, I end over here, and I simply show you some of the important things which I have put in our group. So I have kept one slide of a logbook in which you can see these are the competency which are being selected, and they need to be entered into the logbook. One more thing over here, you can see, as I said, either it is skill, right? If it is knowledge, remember also there is a skill. If this is attitude, you have to take it, select all. All DOP is selected, right? All DOP is selected. Even other things are also being selected. So SH is being selected. Capacity, okay, sorry, certify. P is the performance. You can see gram stain, you'll have to give opportunity to perform gram stain for 5 times. Very similarly, you can see this URTI, LRTI, it is 3 times, and infection control practices, it is 3 times, right? So remember, this much of opportunity will have to give either by a revision or by giving some extra time. Another thing which I like you to start at your institution is this one, right? These are our integration. You can see we have just simply taken integration, that is horizontal, right? You can see this is horizontal integration, temporal coordination, the pathology skill, right, which is being described in microbiology competency. So you can see over here there are 2 colors, right? So we, along with discussion with pathology, we have decided that these particular sessions are going to be conducted, and they are going to enumerate the important microbiology competency in a nesting, right? If possible, first either nesting, and if it will be possible, once again we'll decide whether we can go for either a correlation, right? So we can either plan for nesting or we can go for correlation. That is, earlier time we used to call it as what we can say horizontal and vertical integration, taking a common session between 2 subjects. But the most important difficult part over here comes is that whether the same skill are they going to teach exactly at the same time when we are going to teach. If it is feasible, then okay, definitely it can be taught at that particular time. I'll just show our timetable, and that is how we are progressing. You can see over here, this is the timetable, and over here we are working. If you see over here that the system over here, CVS and CVS, if microbiology and pathology are teaching that, then there are possibility that we can have a common session of that, right? And if we feel that it is not possible because we are teaching over here immunology, they are teaching over here pathology, then this skill or this particular objectives will be taken as the nesting, where microbiologists would be teaching pathology objectives, right? So that would be nesting. And if simultaneous teaching is possible, definitely it can be done as I explained to you with regards to CVS, right? CVS taking in similar time, okay, there is possibility of the correlation. One more thing is linker that we talked last time. Linker, you can take it anytime. And remember, the clinical case-based learning, the portion we can discuss along with microbiology, and when they go in pathology during that time, they can discuss in their time. It is not necessary that it can be done simultaneously. But remember, student would be able to integrate that, because the same case was being discussed by microbiology one time, the same case is being discussed by pathology, and the same case is being discussed by pharmacology, right? So that becomes a linker. So that is also very important. Once again, remember that my timetable may not be feasible or workable for your institution, because your pathologists are different, pharmacologists are different, and they may not adapt our timetable. So I'm simply telling you, as for example, this is what we have prepared, and this is our timetable, because pathologists, pharmacologists, microbiologists, forensic medicine and PSM, we are sitting together and now we are devising that, right? So I don't know whether your institution, your other faculty members would accept that timetable. Another thing which is still remaining is this one, which I would like to share with you people. This is what we have prepared. Remember, this is how we are going to progress for our student. This is what we have prepared, right? Introduction of microbiology lecture followed by demonstration. So this is general microbiology first term, immunology, all methods are being described, and these are the sessions and competencies, CVS and blood, GIT and hepatobiliary system, SS, skin and soft tissue, musculoskeletal infection, lecture, tutorial, how we are going to plan, CNS, respiratory system, cardiovascular, genitourinary system, zoonotic, miscellaneous, and this is our total teaching schedule, right? 183 hours. For our particular thing, I'm very sorry, but the problem is that most of the systems are good. Most of the systems are good, but still we have got something which is to be modified for general microbiology. Dr. Ritu Garg will have to modify CVS and blood. Dr. Shamala is, I don't think she's there, whether if she's there, if she can help, or Dr. Mukesh Kumar was also working in GIT in HP. I don't think we'll be able to complete that, but in your institution, you can copy it down and you can work on that. You work on all systems. Remember, it is important that we bring down to 70, 110, this 10 and 180, right? Right now, because different experts are there and they are working on different systems, we are not able to come to 110, rather we are coming to 162. Dr. Prakash and Dr. Nagaraj have reduced that one to a quite bit level. Still, respiratory systems need to be reduced down, GIT is to be reduced down, and CVS is to be reduced down, and general microbiology still needs to be reduced down. Whatever it may be, we'll have to limit ourselves to 180 hours, that is totally allotted to us. So probably by next weekend, we may be completing our course, but this thing will stay in our Google Sheet. You can continue your work with your experts of other subjects. You can copy down these all things. You can make your own sheet and you can work for your institution, right? So herewith I complete my session, and the session is now open for your suggestion or a discussion. Uh, any query, any suggestion from the participant, you are most welcome. But one thing is very clear, that all of you are requested to work in your institution, because it may not be feasible to complete the task on this large group, right? Dr. Kishore, yes, Dr. Kishore, you are self-muted, Dr. Kishore.
Yes, sir. Good evening, sir.
Good evening. Yes.
Thank you very much for briefing out regarding the logbook in a very detailed way.
Okay, thank you.
I have one query, sir.
Yes, yes.
Sir, regarding this logbook, you have shown one slide regarding logbook, how the student has to write down on the logbook and has to be signed by the faculty. Can you just go to that slide?
Okay. This one?
Yes, sir. Yes, sir.
Okay.
So in this, actually, I just had a doubt. So we have just given an example of Gram-Stein.
Yes.
Performance of the student, and we also discussed as per the competencies given by MCI in the competency CBME competency book. So
Yes.
number of times that a person or a student should perform is about 5 times.
Yes, yes, very right.
Example, if it is a gram stain, he has to perform gram stain for 5 times, Jadan stain for 5 times, and stool examination for 5 times.
Yes, yes.
Is it that the student should be able to get the completion or completion certification? If he does it for the first time, then it is well and good, sir. So
Yes.
if he goes to repeat or remedial measure, so once after doing 3 times, if he comes to the completion, does he need to get the same thing for about, he has to do it again for about 4 more times again after doing these many times?
Yes, you have to, your decision should be complete, and that should be for 5
That
times.
complete should be for about 5 times.
Yes, 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 right.
Oh yeah, yes, that's what I just wanted to have a clarification, because if this is only after finishing 3rd time he is getting the completion according to this.
So
Ans-
unless he sings the songs properly, he'll have to train them like that.
yes, sir. Yes. Yeah, thank you very much. That is the one clarification that I wanted.
Yes,
Thank you, sir.
you're welcome. Any other faculty members, experts would like?
Mukesh Kumar.
Yes, yes, sir, Mukesh Kumar.
ये
Yes,
आप डॉक्टर संजय वो टॉप पे हैंड को क्लिक करें ना, ऑल दी हैंड्स दे कम टुगेदर.
okay.
Yes, Dr. Mukesh. Dr. Nagaraj.
Hello,
Muted
sir.
by
Can
all.
you hear me, sir?
Yes, yes, yes.
Yeah.
Yes.
Sir, continuing this 5 times, sir,
Yes, sir.
we can give 5 slides to be done, and because time factor is a main thing. I think each of these things, will it be all right, or we have to do on a separate occasion?
If you see what we feel that gram stain is also important for LRTI. Gram stain is also important for URTI. So when you take practical,
Yes, sir.
once again you can include that. So that will reduce total number, right? So
Yes, sir.
all clinical disease in which gram stain is important, you can incorporate that along with, right? So at a time giving 5
Yes.
slides, rather it is better if
Yes,
we
sir.
give different practicals.
Sure, sir. Sure. Second thing is,
Yes.
sir, should we also attempt the filling up of the this DOP and all those things in our spreadsheets, which are covering?
Can you once again repeat? I could not understand your
Sir, we
question.
have the our own sheets are there, no, sir. For example,
Okay.
zoonosis one I am covering, no. In
Yes,
that we
yes.
have a DOP section. Should
Yes,
I
yes.
put what are the things I would like to do in that session?
Okay, okay. So once again, you are talking about our microbiology. This is logbook, right? Over here,
Yes, sir.
there are sessions which are being taken from zoonosis and miscellaneous, right?
Yes, sir.
So over here, we'll have to identify what can we do for it, right? This
Sure,
needs to
sir.
be,
Yeah.
this competency needs to be broken down into the teaching learning sessions, right? So how
Yes,
we are
sir.
going to take it. So there are two things. One, you need to prepare a session plan for your institution, and according to that,
Yes.
you need to put it into your logbook, and according to that, we'll have to put it into our journal. 3 things, right? That we have to work on that.
Yes.
I was just simply given an example of gram stain, right? Rest of the things
No,
were
but it's
still
a very nice example, sir. We can actually do for our sessions also. I think that will add
yeah.
to the whole note.
Yeah, we have to work a lot on that, definitely.
Correct, sir.
Thank you, sir. Thank you, sir. Dr. Pratima.
Thank you, sir.
Thank you, sir.
Welcome. Dr. Pratima Gupta. Anybody would like to ask a question can unmute themselves and can ask.
Sir, Dr. Mukesh here, sir. Good evening, sir.
Good evening. How are you?
Good evening. How are you? Fine, sir. Actually, I'm working on that Shamla ma'am. I have reduced to 7 and 8. I'll further try to correct that what you have pointed out today about the 8 number. No, I'll try to work again, sir, on that because earlier it was too much. I have reduced it. Now I'll again see. So, yeah.
Great work by you. Thank you for that.
Yes, sir. Yes, sir. Thank you, sir. Actually, we got an idea how to prepare a logbook because even I have the logbook, but a little bit haphazard is there. I have tried to put the cases for grammar stain. I put the case and then accordingly grammar stain. Then Jadin I put the case and then DOAP and procedure like that. So I put the case and then the source and source house columns I have put, sir. So I think what you have shown some model now. I'll try fit that also, sir. It seems to be really good. It can be work on it.
One more thing I would like
to
all the participants that it is also very important that it is not only skills but anything else which you take in your teaching learning apart from taking lecture and small group, like if you take seminar, if you take examination that is formative, partnering examination, or if you take a case-based learning, or if you take a quiz, please put it in your journal and also put it in your logbook, right? It is also very important part of our teaching learning that we can also add into that. Dr. Pratima, would you like to ask any question? I think you are. Dr. Pratima Gupta?
I think she is unable to unmute herself. She unmuted, but her speaker, we can't hear it.
Okay. I think I don't see any hands raised. If there are any questions, we can discuss on WhatsApp, no problem. We can end the session over here and we'll talk about once again next Tuesday, blueprinting in assessment. Okay, so that is also very important. So we can end the session over here, sir.
Thank you, Dr. Sanjay.
Thank you, sir. Thank you.
Okay. Thank you very much.
Thank you very much.
It will be a good idea if your group creates a logbook for all the chapters and jointly,
Definitely.
and it will be.
Yeah. Whether this course would be over, but we'll continue to work on this sheet, right? We'll continue to work.
Yes.
Yes, surely.
Yes.
Okay.
Thank you.
Goodbye. Goodbye.